My name's Caitlin, and my project is on schizophrenia. Schizophrenia is a mental disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. Although the course of schizophrenia varies among individuals, schizophrenia is typically persistent and can be both severe and disabling. Schizophrenia and what we know about it. Schizophrenia has a spectrum of disorders that all involve a disconnection from reality, including hallucinations and delusions. It also affects a person's ability to recognize the symptoms they have of this condition. It's a severe condition, but it is treatable, and many people with it can still live happy and fulfilling lives. According to American Psychiatric Association, around 2.8 million people live with this condition. It develops usually in the mid-20s, and early onset can show at 13. It is very rare for it to present before 13. As you can see, I've listed some of the disorders in the spectrum of schizophrenia. Schizophrenia presents in 3 stages: onset, active, and residual. Onset stage is before severe symptoms. The active stage is the psychotic break, and residual is the last stage with some symptoms still present. What are the symptoms in the onset of schizophrenia? Social withdrawal, anxiety, lack of motivation, neglect of personal hygiene, afraid, suspicious, or paranoid behaviors. What are some of the symptoms during the psychotic break? Delusions, hallucinations, disorganized or incoherent speaking, disorganized or unusual movements, negative symptoms. Negative symptoms usually involve a decrease in emotion in a person's facial expressions, how they speak, such as with a flat or emotionless voice, and fewer or no gestures with their hands or other parts of their body. They also involve a lack of motivation, especially when they don't want to socialize or do things that they ordinarily enjoy. During the residual stage, a person may experience odd beliefs, lack of motivation, decreased feelings of enjoyment or pleasure, limited speaking, etc. People may seem healed, but the truth is this is probably only temporary and symptoms will return. What causes schizophrenia and its spectrum of conditions? The 3 main reasons include imbalances in chemical signals your brain uses for cell-to-cell communication, brain development problems before birth, or loss of connections between different areas of your brain. What risks are associated with schizophrenia? Cleveland Clinic reports that genetics play a role. People who have had a parent or sibling with it have a much greater risk of developing it. Another risk factor can be the environment. Certain illnesses and extreme stress over a period of time may play a role. Birth circumstances may also play a role. Did the mom have gestational diabetes, preeclampsia, malnutrition, or vitamin D deficiency? Was the person underweight at birth, or did the mom deliver C-section? Cleveland Clinic researchers have also linked the use of recreational drugs to the likelihood of developing schizophrenia. How is schizophrenia diagnosed? The diagnosis usually requires a physical exam, tests and screenings such as MRI or CT scans of the brain, psychiatric evaluation and diagnostic criteria using the criteria in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Can a person live a normal life with schizophrenia? The answer is yes, but schizophrenia requires lifelong treatment. Even when there are no symptoms, the person needs to be under treatment. They can be treated with medication or psychotherapy. There are 2 types of medications used to treat schizophrenia: typical antipsychotics, referred to as first-generation antipsychotics. They block how your brain uses dopamine, a chemical your brain uses for cell-to-cell communication. Atypical antipsychotics, these medications work differently from first-generation antipsychotics. They block both dopamine and serotonin. Both of these are key chemicals in the brain used for communication. I've listed below some of the medications used to treat schizophrenia. Besides medication, there are therapies that can help. Psychotherapy methods like cognitive behavior therapy can help with the condition and associated problems such as anxiety, depression, and substance abuse. Other methods such as art and drama therapies can help motivate the person's ability to recognize symptoms. Electroconvulsive therapy involves using an electrical current applied to the scalp, which results in a brief seizure. This treatment usually works when other ones don't and can be life-saving when the person is suicidal. There are many myths concerning schizophrenia. Some include they have split personalities. They don't. They have one personality that is disconnected from reality. They are dangerous. Well, not necessarily. If they are, it is usually because they have an additional condition, such as substance abuse or are bipolar. They are the product of bad parenting. Again, false. Schizophrenia is a mental illness. They have it because one of their parents had it. This is not necessarily true. They have a 10% greater risk if one parent has the condition, though. They belong in a mental hospital. Again, not true. As we learn more about this condition, fewer are institutionalized. Another myth is that they are not smart. This is false. John Nash, a famous mathematician, was highly intelligent. The movie A Beautiful Mind shows the struggles and symptoms Nash exhibited during his life as depicted by the movie. In the next slide, I'm going to show a short clip from the movie, but I just want to give a brief warning that there are some graphic scenes and images of self-harm.
The Carnegie Prize has been split, hence it's all bent.
He's got his sights set on Wheeler Lab, the new military think tank at MIT.
Well, they're only taking one this year.
Hence is used to being picked first.
Oh, yeah, he's wasted on that.
He should be running for president.
There could be a mathematical explanation for how bad your tie is.
You've been in here for 2 days.
You know, Hans has just published another paper. I can't even find a topic for my doctor.
Well, on the bright side, you've invented window art.
This is a group playing touch football. This is a cluster of pigeons fighting over breadcrumbs. And this here is a woman who was chasing a man who stole her purse.
John, you watched a mugging. That's weird.
John?
Turn it off. Turn off the light. Why would you do that? Why would you turn the light on?
What's wrong with you?
You have to go to your sister's. And the car in the back. Hey, you take problem off. No side streets.
John.
Stay where it's crowded.
John, I'm not going anywhere.
You get to your sister's. You wait for me to call you.
No, I'm not going.
Just get your things.
I'm not leaving.
Stop! Stop it. Please. Alicia. I'll explain when I can. Charles? I didn't mean to get you involved in this. I'm sorry. Charles? The prodigal roommate revealed. Saw my name on the lecture slate. You lying son of a bitch!
Who are you talking to? Tell me who you see.
I didn't say Charles Herman in Russian.
There's no one there, John. There's no one there.
Code red. Dr. Rosen, code red, observation room 2. Dr. Rosen, code red, observation room 2.
John? John?
No,
Hello, I need Dr. Rosen's office, please.
you gotta stop her, John. You leave her out of this.
Who are you talking to?
It's not her fault.
John.
She'll compromise us again. No, she won't. You'll go back to the hospital.
John, answer me.
Countless people will die. Alicia, please, put the phone down. I can't let that happen.
Yes. Hello. Hi, I need Dr. Rosen. Is he in?
I'm sorry, John. No!
You know what you have to do, man. She's too great a risk.
Get away!
I didn't mean to hurt you. Finish her.
In conclusion, can a person live a normal life with schizophrenia? It is possible, but to be successful, the person must remain under treatment. Sadly, it is not preventable, nor is it curable. It can, however, often be manageable with the right treatment plan, which varies from person to person. I just want to say thank you for watching my presentation and learning about schizophrenia with me.